now it's with great pleasure that I introduce today's Assembly Speaker. 1976 graduate from National College, where he says he followed a Palmer College chiropractor through this whole national career so he could learn some chiropractic. He has been so involved with chiropractic for the last 38 years. It's a pleasure to have Dr. Jay Holder with us. His son is a third quarter student with us, Aaron Holder. My pleasure to introduce Dr. Jay Holder.
Thank you. Yeah, can we get the first slide up? That's the second slide. All right. There's somebody behind the curtain. There really is. Like the Wizard of Oz, right? I needed that because I want to know what to talk about. The tonal model of the subluxation, the brain reward cascade and reward deficiency syndrome. That's a lot of information in 40 minutes. So I'll do the best I can. Let's talk about the tonal model. D.D. Palmer discovered chiropractic in 1895, but it really didn't happen in 1895. And he said that he did it based on tone. The most important comment, the most important issue of the profession, and in the last 100 years, there's not one book written on it, written on tone. It's incomprehensible, but we need to really understand what tone is, and we're going to wet our feet on this. Picture the spinal cord living. Now, of course, with no bone, that's impossible. So just picture a spinal column with the bone removed, and the spinal cord is vital. It's not fixed, it's not fixated, it's not in formaldehyde. Okay, and it's attached to the brain, which also, all the skull bones are gone. It's lying on the table. What's going to happen? It's going to herniate and implode because it can't support its own weight. Why? Because the brain and spinal cord is a gel. If it's not fixed, it's alive, it's functioning, it's a gel. And it's mostly water. It really can't support its own weight. We have to understand that it's a piezoelectric gel on top of that. And what is piezoelectric? Piezoelectric means that under pressure, distortion, distension, torsion, it's going to elicit an electrical discharge. How often is this electrical discharge going to be elicited? Now, there was a scientist back in the 1800s by the name of Hertz, not related to the rental car guy. And Hertz said that we're going to take a compartment of 1 second, and how often something occurs in this 1 second. That's going to be frequency. In other words, how frequently something occurs within a compartment of 1 second is going to be Hertz frequency. So if a nerve elicits an electrical discharge 5 times a second, it's 5 Hertz. Now, here we have, and I'm going to digress, I'm going to go back to D.D. What's really amazing about D.D. Palmer, from what I understand, it's like he didn't graduate Harvard. He didn't go to any big universities. As a matter of fact, he was self-taught, and for the most part, never really went to school. And try to imagine somebody like this, somebody with a background like that, inventing quantum physics and the holographic model. Now you're going to say, well, that's a stretch because Heisenberg invented quantum physics and got the Nobel Prize for it in 1928. Well, that's unfortunate. There's political reasons why that happened. And when I say political, I mean emotionally political, because of a lack of discord between BJ and his father. But D.D. Palmer discovered quantum physics. He had to do that to create the concept of chiropractic and the adjustment and the subluxation in his mind. That's how huge of a genius we're talking about. It's beyond my comprehension. Now, how can I stand here with the common sense of everybody in the room and suggest that D.D. Palmer invented quantum physics and the holographic model as early is, let's say, 1890, 1892, and to be able to, in 1895, make the first adjustment. Well, I'm going to move up for a second, then digress again. In 1914, D.D. had his second book published. A lot of you are not aware that D.D. Palmer wrote a second book because of those political problems. But he wrote a second book, and it's called The Chiropractor. And it was copyrighted. This is a federal copyright in 1914. Well, that predates 1928. If you read that book, you'll see that that's the quantum physics model, the holographic model, and it's his. Now, he was dead in 1914 because he had left Davenport because it was too small for both him and BJ. And he fled to Los Angeles to open up a Palmer School of Chiropractic in L.A., and he did. But then he got typhoid fever and he died. It was released by his fifth wife, his widow. I don't know if it was typhoid fever or 5 wives. But in any case, if you have a chance to find that book, it's quite a read. This is all focused on what is tone. And I'm going to digress even further now, so I have a lot of catching up to do. Listen to this. All communication in the third dimension is tonal. And D.D. Palmer was the one to discover that. And this is the foundation, the hallmark upon which chiropractic is based. That all communication in the third dimension is tonal. Everything. There's no form of communication known that is not tonal. So here's D.D. Palmer in the 1800s, after about 5 years of practicing as a magnetic healer. He did that for 10 years. And halfway through, he's trying to figure out how the body communicates within itself to manifest dis-ease. And how could he, as an intermediary, intercede in some way to allow the self-healing organism to regroup and do just that through its compensatory mechanisms to heal self. Because he was smart enough to know, and actually the healing arts knew for thousands of years, that we're not in a position to cure or heal anything. You need to realize that right away. Now, here he is in the 1890s, and he's trying to figure out how to do this. He understood that of all the billions of cells in the body are under the direct control and communication of an intact nervous system. So if he would have known about the word chiropractic at that point, and he didn't, he would have said, what do we need to create chiropractic for? Why do we need chiropractors? Why did God create chiropractors? That's an interesting question you might want to answer. Certainly you need to think about it, because if the body is a self-healing organism, and the billions of cells in the body are under the direct control and communication of an intact nervous system, then what do we need a chiropractor or a chiropractic for? Well, there are limitations to matter. And sometimes when the body subluxates, the subluxation is a primary subluxation. It's so overwhelming the body can't compensate out of it, can't get rid of it. But going back to D.D., in these early days, he's trying to figure out how all of this communication is taking place. So he had to create a paradigm, a model, in his mind, based on a tonal concept. And he said later that's exactly what he did. He based it on tone. That all communication in the third dimension is tonal. That would mean even between cells. Even between the cells and all the cells in the body. But now, if we do critical thinking, and please, when you graduate, continue your critical thinking, run this again. There's billions of cells in the body. They're all under the direct control and communication of an intact nervous system. how in the heck is that possible when very few of the billions of cells ever come in contact with a nerve? Now, that's interesting. It almost sounds like this isn't going to work. The tonal model is the answer. Every nerve in the body fires or elicits an electrical discharge because it's a piezoelectric gel, the tissue, nerve tissue is. So many times a second, they're all multiples of 5. And then there's the law of double. The vagus fires 5 times a second, the glossopharyngeal 10. The trigeminal 20, and so on. So 20, 40, 80, 160, and so on. If the nerves are firing at their proper multiplication basis of 5, and the communication allows what's supposed to happen, then there's no dysfunction or disease. But what happens if the Hertz frequencies of the nerve tissue are interfered with? Nerve interference. That's what DD called nerve interference. What happens? Well, over a period of time, people acquire subluxations, and a subluxation is a separation from wholeness. Being that the dural attachments, which attach to some of the more common levels of the spinal column, have torsion or distortion or distension, and that's what alters the frequency. Now, there are 86 so far known neurotransmitters that are released, but they can't be released unless the nerves are firing at the proper Hertz frequency. Let's see the next slide. Or do I have to do that? I think I have to do that. Okay. This is the 1914 book by D.D. Palmer that you've probably never seen, that we just talked about. This is the chiropractic textbook, which you should all be reading and read it over and over. When you graduate, read it again. This is the greatest single book ever written in chiropractic by R.W. Stevenson. This is the 1948 edition. Within that book, on the first paragraph, he talks about 2 different types of subluxations. He talks about the cord pressure subluxation and the cord tension subluxation. So not all subluxations are created equal. Now, we're going to find out in a little bit that the cord tension subluxations, well, let's do this for a second. Look at me. I've got 2 vertebrae. They're identical. They both subluxate identically. And of course, this can't really happen. This is just an example. Okay. One has dural attachment and the other doesn't. And since nerve tissue is a piezoelectric gel, we're going to change and alter the normal Hertz frequencies, which are a multiple of 5, and it's going to switch to a frequency that's going to be a multiple of 64 Hertz. Now, 64 Hertz is the common denominator for subluxations. We're going to get to that. So all things being equal, I have 2 subluxations here. This one has dural attachment and this one doesn't. But they're both identically the same shaped bone, and they're both identically the same listing. They're subluxated the same way. Which one is going to have greater neurological insult? This one or this one? This one, obviously. Because it has the dural attachment, the direct dural attachment. And of course, we have direct dural attachment at occiput, and at C2, and at C5, and at S2, 3, and 4, and coccyx. We have indirect dural attachment at atlas. If we have time, we'll get to that. So there's the cord pressure subluxation and cord tension subluxation. The cord tension subluxation is the one that has the dural attachment. The cord pressure subluxation is the same subluxation but without dural attachment. So those are usually going to be secondary subluxations. They're usually going to be compensatory to the primary. So at any moment in time, there's going to be an average of 10 listings in any individual. You lie somebody down on the table and you look long enough and you're searching, you're, doing your diagnostic, intervention, you're going to find an average of 10. Out of the 10, there's only one primary. So the symptoms of the primary subluxation are the secondaries and tertiaries. The problem is, the risk here is if you wind up adjusting the secondaries and tertiaries, you just make the primary stronger, and that pattern is going to wind up showing up on the next visit. So that won't allow the patient to retrace, and you're not going to get lifetime care. Now, if there was more time today, we could take the tonal model to that next step, but there isn't enough time. Let's take a look at what's really great about this book is R.W. Stevenson was a very famous illustrator, and his ability to be able to write these lengthy concepts into just one or two sentences was a real gift, and that's why BJ directed him to write this book. But the added plus was he was a very famous illustrator before he went to chiropractic school. All the drawings in the book are his as well. This figure shows the difference between a cord pressure subluxation and a cord tension subluxation. So you see the lateral C2 up on top? That's the classic. You have about 20 dentate ligaments ring around the roseate C2. Okay. The one underneath it, that's probably L4. Okay. And this, of course, is showing the dural attachment at coccyx, which used to be a very big deal. As a matter of fact, there's the famous Palmer chiropractic adjustment, or the move that's mentioned in several books. Actually, the volume 2 to the chiropractic textbook is The Art of Chiropractic, written a few months after this book. That's a lost book also. You probably have never seen that. There's 2 chapters on the primary subluxation of coccyx, and this is a Palmer upper cervical manual. So why would there be 2 chapters? And another thing, I know I'm digressing right now, but in one of those two chapters is the very first time in print that the term straight chiropractic appears, wherein R.W. Stevenson is explaining that some schools, some chiropractors will adjust the coccyx subluxation internally or through the rectum, okay, which is considered surgery. But being done on the outside, the Palmer coccyx method, as it was called in the paragraph, it says, quote, is the straight chiropractic method. Maybe we'll be able to see that later. This is the indirect dural attachment at the rectus capitis posterior minor muscle, which allows us to understand the importance of C2 not having direct dural attachment. And here's a rule that you're not going to have in any books, and you're never going to hear after today. So you might want to write it down. Okay. As far as a rule for dural attachments, you can't have any direct dural attachment to bone in any 2 truly articulating segments in a row. And you won't find that. Okay. That rule won't ever break. Okay, so D.D. Palmer discovers chiropractic in 1895 with an adjustment, but he has, prior to 1895, put together in his head the concept of tone and the ability of the body to communicate within, and that when there's interference due to subluxation and pull or stretch or distortion or distension on dura, or at levels of subluxation where there's dural attachment, we're going to default of a multiple of 5 hertz to 64. Of course, in his day, he didn't know that it was 5 hertz or 10 hertz or 64. He just knew that the distortion of dura was piezoelectric, and he knew that this was a separation from wholeness. He saw the subluxation as a separation from wholeness. He saw the adjustment as a communication through touch. So what's that? You know, chiropractic is the only healing arts profession that is communication through touch. There isn't any other profession that can do that. In other words, there's a line of drive, there's your intent, there's the contact of your hand, and there's the connection between you and the patient's right brain. So the tonal model is the transmission. Remember, all communication in the third dimension is tonal. The adjustment with a little something extra is your ability to apply 3 forms of intent into the tonal model. This is based on a quantum holographic concept. And of course, if you read the Green Book, The Adjustment with a Little Something Extra, you'll understand that these 3 make a lot of sense. And that's why the book is called The Adjustment with a Little Something Extra. This is not for everybody. But listen to this. The first and there are 3 conscious intentions. The first one is when you walk up to the patient, you become one with the patient. You're not the doctor, and the patient's not the patient. As a matter of fact, you could consider at this moment that you're practice partners. That's the first conscious intention, that you're one. And that you're not there to fix anything because you don't have the power to fix anything. The second conscious intention is to visualize the subluxation. Well, how do you do that? It doesn't matter. There aren't any rules. You can do it in color or black and white, a cartoon in your head, but you visualize the subluxation. Of course, you've done your diagnostic intervention, so you know what the listing is. And once you visualize the subluxation, as you make the adjustment, you see it as whole, as if it's not subluxated. Now, these 3 conscious intentions, back in the time that BJ wrote the book, and in BJ's day and in Dee Dee's day, a lot of people thought these guys were screwballs. They were absolutely crazy. And that intention, which was a major part of practice, was ridiculous. 1980 comes along a guy by the name of Roger Sperry. He takes living human brains, he separates the brain down the center, separating the right and left cerebral hemispheres from each other. In other words, he dissects through the corpus callosum. These are living human brains. And he attaches wires to each hemisphere to see what language they speak. And by the way, science is constantly expediting this whole idea of communication within the body and the universe. And they're always coming back to the default of it's all tonal. And by the way, if I have to define tone to you, I just refer you to Webster's Dictionary or American College Dictionary. It's one sentence. Vibration through atmosphere. And then we go back to how many times a second that vibration manifests. Well, he hooked up wires to each hemisphere. And he was able to determine the language. And of course, this goes back to the metaphysics guys for thousands of years, the woo-woo-wah-wah people. And I would say that the right brain is spiritual and the left brain is intellectual. And that was part of his reasoning for even going here to do this type of work. Guess what he found out? The right brain communicates as a transmitter. And the right brain can be interfered with by the left hemisphere, but the right hemisphere can't interfere with the left. Okay. And that the right is constantly transmitting to other right hemispheres wherever, such as going back to the patients on the table, and you become one. Now, this sounds like a little harebrained. You probably never heard of this research, have you? Well, you got the Nobel Prize in '82 for it, the following year. It usually takes 20 years to get the Nobel Prize for something you did like 20 years ago. It was such a big deal that he got it the following year. He has a book out which the title, I'm not correct on this, but it's something like A World Divided. So everything that's happening now in science is vindicating what these two screwballs, BJ and DD, did a long time ago. Now, when D.D. Palmer discovered chiropractic, he did something much bigger. Again, remember, he discovered quantum physics in the holographic model to be able to go on to do the chiropractic. So when we say that the adjustment, and I digress to go back to where I left off, the adjustment is communication through touch, and we're the only healing arts profession that's able to do that. There is none other. Communication through touch. How does that work? I need a volunteer. Now watch this. Did it take any force to get him out of his chair? I don't think so. And I didn't force you, right? Okay. I had my fingertip in his armpit. Anyway, I had my fingertip under his armpit, and all I did was change the line of drive. Now catch this, because this is the whole deal for the 40 minutes. There had to be somebody home. There had to be somebody home. This isn't working, dead people. Now I'm going to explain something, and it's only an example. And it doesn't work 100% as an example. So don't bust my chops on this in your head. Innate intelligence. You've heard that before. Probably nobody in here knows what innate is. But you use it a lot because you got sort of an idea. Somebody had to be home. In other words, my communication through touch was a direction which was perceived by his neurophysiology, whatever you want to call it, and then going to a much higher level, an innate intelligence, where he decided then that superior must mean to stand up, and lateral must mean to go forward, and medial must mean to go to the left, and then to the right, and then back down again. But the problem with this example is that this is intellectual, this experience. The intelligence within right here, he sort of thought this and figured this out. Innate is at a much higher level. In other words, this is a little left brain. Innate is more right brain, but I don't want to limit it to that. Innate is everything. So chiropractic is communication through touch. That's the difference between a manipulation and an adjustment. One of the problems in the profession is that we're losing the subluxation because it's so easy to critically think that, oh, what's the difference between a manipulation? It's just semantics, right? You really mean the same thing. That's what all of you are going to be thinking most of your practicing years. But please, rethink it. A manipulation is a dictation. There's no communication through touch. You're fixing something. You can't fix a subluxation. You can't treat a subluxation. You can't correct a subluxation. You can make an adjustment, a communication through touch. And if the body, the innate intelligence, receives that and decides that it's going to hold the adjustment, that's right, you can't make the body hold an adjustment. But sometimes the body doesn't. So if the body sometimes doesn't, that means you're not in a position to see to it that the body's going to hold an adjustment. Well, if that's the case, then if the body's going to, in this example, decide to hold the adjustment, it's not done. The primary is still there. The subluxation is still there. Who's going to fix that subluxation? Not you, not me. Innate. And that's a process. It doesn't happen instantly. Some people say on an average it could take 20 minutes. Do you wait 20 minutes between an adjustment? We just said that this process of the body receiving the communication through touch, the adjustment, then deciding to hold the adjustment, then moves on to another stage to self-correct its own primary listing. That's a process. It's not instantaneous. And I already said before that there's an average of 10 listings and there's only one primary, and the symptoms of the primary are the 9 secondaries and tertiaries, for a total of 10. And if you don't touch those 9 and you only focus on the primary, then when that primary does get self-corrected, innate corrects that primary subluxation, what happens to the other 9? They're gone in a nanosecond. And then what happens? Don't think for a moment that I'm one of those chiropractors where we just adjust to one thing. Or you may choose to do that if the patient's acute. But if the patient's chronic or regular scheduled patient, what's going to happen? In either case, well, certainly you're going to look to adjust something else. You don't wait 20 minutes. You're going to adjust three listings in a visit. That's an hour. You can't afford to do that unless you use an open room and you have resting rooms like they did back in the good old days. But listen to this. If you allow the 20 minutes, and it's an average, it could be 10 minutes, but an average of 20, the body, or innate, corrects the primary subluxation, and the other 9 are now gone. What happens? A new layer comes up. What's that called? A new layer of 10. Oh, no, there's another 10 now. Because there can't be a primary subluxation without the compensatory mechanism of the other 9. Where are these compensatory mechanisms coming from? Well, you've heard of like the Lovett brother reactors, we don't have time to get into all of them. There's a lot of them. Because the body's a self-healing organism, wants to get rid of the primary that it put there in the first place as a circuit breaker to blow a fuse so worse things don't happen. The primary subluxation is a good thing. And they're ships like, ships passing in the night. The body is creating subluxations and taking them away as we sit here. But every now and then there's some overwhelming primary and the body can't correct it, limitations of matter. That's why God created chiropractors. If you allow this layering or retracing, then each chiropractic visit is an aggressive step towards state of well-being and human potential. And now you can deliver lifetime care. However, if you adjust any secondary and tertiary subluxations before that primary self-corrected, the same listing, the same layer is going to be back on the next visit. The patient's going to have that pattern for their whole life because you put it there. Why? Because the nervous system records and memorizes everything it perceives. I'll give you an example. In other words, why this could happen, this terrible thing about if I adjust any secondaries and tertiaries, because, by the way, if you don't wait to 20 minutes, all you have available to you are the secondaries and tertiaries. You just adjusted the primary, remember? And now you're immediately going to adjust something else. Well, if you did adjust the primary, there is nothing else but a secondary or tertiary. Why is that bad? I'll give you an example. Johnny's 5 years old, 10 years old, 50 years old. Comes in, has a bacterial infection. Okay, diarrhea and a fever. Those are compensatory mechanisms. All compensatory mechanisms in the body are generally neurological. They're certainly all directed neurologically. The primary is the bacteria. Don't bust my chops on this in your heads either. It's just an example. So Johnny's got a bacterial infection. Can he feel the bacteria? No. Can he feel the primary? No. Primary subluxation is symptom-free. It's not where the neck pain is. It's not where the back pain is. You got to stop that. The bacteria is symptom-free, except for the fever and the diarrhea, which are compensatory mechanisms so that the body's a self-healing organism to get rid of the fever. What happens if I step in and I treat the fever Well, I can treat the fever. But if I do that, I'm going to make the bacteria stronger. You understand? They're going to send me a thank you card. What happens when the bacteria are compromised? The self-healing organism take care of the bacteria. The fever does what? Oh, it breaks, gone in a nanosecond, as any compensation would be. Okay, we're going to move on. There's so little time. We only have a few more minutes. What I really like to do is explain to you about how state of well-being and human potential is possible, because that's what the adjustment is for. The adjustment's not for neck pain, back pain. That's not what it's for. Because we don't treat a condition, a disease, or a symptom. That's not what chiropractic is. Chiropractic is subluxation-centered, so we're making an adjustment. We're adjusting the subluxation. And the subluxation is not the bone. The subluxation is not a bone. The bone subluxates, but the subluxation is not a bone. You know what the subluxation is? It's a neurological projection in three-dimensional space. Remember right brain? Remember piezoelectric gel? Remember Hertz frequencies? Remember quantum physics in a holographic model? And communication to all the cells? This is what D.D. Palmer innovated. He never went to school. The bone is not the subluxation. The bone subluxates, but it's not the subluxation. The subluxation is a neurological projection in three-dimensional space. You have to become one with that listing to be part of the picture to make the adjustment. So if you're not adjusting neck pain and you're not adjusting back pain, because you can't correct these things anyway, you can't even correct the subluxation, you can only adjust it. What is going to be the end result of these torsions and distortions and distensions on tissue to allow for each adjustment to be an aggressive move to take the patient through lifetime care to reach better state of human potential or state of well-being and improve human potential? Well, I'm going to show you. The limbic system, as an example, is the seat of emotions. Okay, so in this slide, we have a square in the hemisection of the brain. There are tissues in the brain. Of course, each one is a multiple of 5, and all firing at a certain frequency to release neurotransmitters. And when they're released, they go to the next tissue and have this domino effect or cascade until there's an end result. So let's do this quick. We probably only have enough time for this. In the hypothalamus is producing several neurotransmitters, starting with tryptophan, which is metabolized to 5-HTP, 5-hydroxytryptophan, which then stimulates the release of serotonin. And serotonin then is going to trigger a cascade of methionine and enkephalin. The methionine and enkephalin is going to sit out here on the border of the hypothalamus just waiting. Let's go to the substantia nigra. The substantia nigra, it produces, if left to its own design, huge amount of GABA. GABA, gamma-aminobutyric acid. Well, the problem with GABA is it destroys dopamine, and the ventral tegmental region overproduces that. So innate intelligence, which is the mind, body, spirit, nature, subconscious mind, that's innate, according to B.J. Palmer, 1920, page 159. The Green Book, The Science of Chiropractic. Well, we understand GABA destroys dopamine. Okay, so we need the methionine and enkephalin now to come in, which competes with the GABA, so just the right amount of dopamine is released from the ventral tegmental region, and it goes to the nucleus accumbens and the amygdala, and then you feel good. That's a state of well-being. And that's a tonal model. And that's modern science and mainstream medicine, which wouldn't be possible today if it wasn't for D.D. Palmer. But Heisenberg gets the credit because father and son didn't get along. That's a whole other story. The square on the right side is a blow-up of that. I'm not going to go through it again. We don't have time. I'm hoping, oh, by the way, there's your science of chiropractic. The mind, soul, spirit, nature, instinct, intuition, subconscious mind, or as I prefer to name it, the innate intelligence. So now you know what innate intelligence is. Didn't know when you came in. You sort of had a sense, but now you know what it is. I mean, if BJ can't tell you what it is, I guess nobody can. How much time do I have? 5? Okay. Now comes 1983, before the New York Academy of Sciences and Oncogenesis and Tumor Growth. I mean, picture this. They laughed at us. They were 100 years too early. And in 1988, Candace Pert, while a graduate student at Johns Hopkins discovers the opiate receptor, graduate students clean test tubes. She comes out with this paper. She's trying to find out, oncogenesis and tumor growth, how do all the cells in the body sort of turn on each other and we have cancer? This breakdown of communication between the cells. She wound up doing chiropractic research after this paper got published. She realized that the psychoneuroimmunology, she invented that field. It was just a higher form of chiropractic. Amazing. Let's just get to the paper. I got 2 minutes. In this section of the paper, the amygdala and hypothalamus, are used to identify the limbic system. Remember, we just did the brain reward cascade. That's limbic system tissue. It's only sitting in the base of the brain, they thought, up to 1988. Now she finds, hey, that this presence of this tissue suggests that the usual picture of the limbic system should be extended to the spinal cord, to the dorsal horns of the spinal cord. There's more limbic system tissue to allow for state of well-being and human potential in the spinal cord than there ever was in the brain. And guess what? The mesolimbic system, that's the new name for the one in the brain, is sitting on the sphenoid, which used to be C1. Yeah, sphenoid's a vertebrae. It's got all the parts that a vertebrae is supposed to have, from spinal canal to transverse processes. The dorsal horn. Watch this. We're not done. Then at the end of the paper, she says, Freud comes along and says, hey, the unconscious mind. He invented that term. But her research suggests that the conscious and unconscious, the unconscious, it would be towards the back, but we, meaning the authors, would go further back or down, and back in quotation marks means the phylum terminal at the coccyx, that the subconscious is in the spinal cord, and even lower, in quotation marks, the coccyx. I don't have enough time to really finish this, but now hear this. If she's finding in the nervous system for all communication and psychoneuroimmunology and oncogenesis and tumor growth, that the subconscious mind is in your ass. We already learned in 1920 book, The Science of Chiropractic, that innate intelligence is the mind, the soul, the spirit, the nature, the subconscious mind, or as I prefer to name it, the innate intelligence. That's the quote. We've come full circle. So what's an adjustment going to mean tomorrow? You're not moving a bone anymore. You're a part of it. It's a practice partner. You're not the doctor. You are working in Aegis with innate. There's got to be somebody home. If you're trying to deliver something, somebody's got to answer the door. Thank you very much.